My name is Marissa O'Neill, and I run RetireMed. We have an office right down the street, we're right across from LexisNexis and 675 there. And we also have one down in Cincinnati. I split my time between the two. You know, a few of my friends, I told them, do you want to come listen to me talk about Medicare for 45 minutes tonight? And they weren't overly excited. So I'm just thrilled that you're all here. So thank you for coming. But I think my family is very relieved that I have a group like this to talk to so that they don't have to, hear me talk about Medicare all the time. But truly, this is all we do is Medicare and individual health insurance. So I always relish any opportunity to talk about it, especially this year when we are looking at more Medicare changes for 2025 than what we've seen probably since 2010. So I'll go through all of that tonight and kind of walk us through a whole bunch of information. I know that most of you are probably familiar with this, but I thought the best way to start would be just a real quick refresher on Medicare. So start with the basics. It's the federal health insurance program. You all know that. It was established in 1965. So the three criteria that you need to be on Medicare, you have to be 65 or older, or if you're younger than 65, you're on Social Security disability for 2 years, then you could be eligible. Additionally, and on that, people with end-stage renal disease or Lou Gehrig's disease, ALS, they are eligible for Medicare. So the different parts of Medicare, just a quick reminder on those. Medicare Part A, so this is your hospitalization, inpatient hospital stay, skilled nursing facility, home health care. Most people don't pay for Part A. You've paid taxes your whole life for it, or you had a spouse that did so you're set on Medicare Part A. Medicare Part B, on the other hand, this is the doctor side of things. So outpatient procedures, doctor's appointments, medical supplies, preventative services. This is the one that they take directly out of your Social Security check. This year, it's right around $175 a month. It is income dependent, so if you're a high earner, you might be paying more than that, but they pull it right out of your Social Security check. The other good news is if you maybe sell a house or there's some reason you're a high earner 1 year, it does correct down over time. So just a little tidbit there. The third one here, Medicare Part C, this is what's known as your Medicare Advantage plan. So essentially this is a combination of its coverage. It's one health plan that covers your Medicare Part A and Part B. It's an approved plan by the government, but a private insurance company offers it. And it's an alternative to original Medicare. I'll talk more about that in a couple minutes. And then last, Part D. So really the two that I'm going to talk the most about today are the Part C and the Part D. The Part D drugs, this is your drug plan, all of your prescription coverage that you would have. You know, when I was first learning this industry, and I was learning all of this, I thought, all right, I don't take any prescriptions. Why would I want the prescription drug plan? Well, you have to have one because it's like car insurance. I also don't plan on getting in a car accident, but I did in a traffic circle this year. We were talking about traffic circles, so everything was fine. So that's kind of the ins and outs of the general Medicare. So what I do want to also refresh you on is the difference between Medicare Advantage and Medicare supplements and Part D plans. So typically, an individual original Medicare, that's the red, white, and blue card that you get from the government when you turn 65 or enroll in Medicare. So that's the premium they take out of your Social Security check. You have a deductible on that, and then you pay 20%, government pays 80% on Medicare. The problem with just having original Medicare is there's no maximum that you have. There's no kind of ceiling. If you only have that, and say you went into the hospital on January 2nd, you'd pay a deductible. If you're out of the hospital consistently for maybe 3 or 4 months and you go back into the hospital, you're gonna pay that deductible again. So most people, what they choose to do is to back up their Medicare, their original Medicare, with either a Medicare supplement or a Medicare Advantage plan. So supplements, these are your letters A through N, your more traditional route. You're gonna get these through Anthem, Humana, Aetna, any of the big carriers. And these are the ones that, let's say you're on a G plan or an F plan supplement. You're gonna pay your premium to the insurance company. When you go to the doctor, you're gonna show them your red, white, and blue Medicare card. Then you're gonna show them your Medicare supplement card. The doctor will send the bill for your visit to the government. They'll pay their portion, turn around and send the remainder of that to the insurance company. As long as you're paying your premium and it's a Medicare covered expense, you typically aren't gonna see anything out of pocket for those. You might have a small deductible at the beginning of the year, things like that, but generally anything covered by Medicare, you don't see any extra cost for. So I always think the easiest way to look at these plans is you pay in case you go to the doctor or you pay in case you use it. Now that's your health, that's your medical coverage. The thing that the supplements do not cover are your drugs. So you have to purchase a Part D drug plan to go with it. I'm gonna talk a lot about the Part D drug plans tonight because those are really changing for next year. The other alternative is the Medicare Advantage plan. And these work very different than the supplements. The supplements, as long as anyone accepts Medicare, they're gonna accept your supplement. The Advantage plan, these plans are typically your little to no monthly premium. These are the zero premium plans you see all the time. But then you have copays for everything you do throughout the year. You're in the hospital, you might pay $200 to $300 per day. You go see a specialist, you might pay $30 to $50. All of that is outlined in a book every single year for you. So, whereas these are also network-based. So there's HMO and PPO. You have to go see, you can go in and out of network if you're on some plans. You have to go see network docs if you're on certain plans. Now, these plans do include some extra benefits, some hearing, some vision, some dental, et cetera. And they include your Part D drug plan with your medical insurance. So it's all just one plan. So kind of what I said earlier, these plans, instead of paying in case you use it, you pay when you use it. But they have a maximum out of pocket every year, so you kind of know your worst case scenario going in. Now, the way that these plans work, and a lot of what I'm going to talk about later, is that these plans, the government says, all right, insurance company, let's just use Humana as an example. Humana, I'm going to pay you a certain amount each month, and you're going to take care of this person on the Medicare Advantage plan. We don't want to see any bills. We don't want to see anything administrative. We don't want to deal with anything. We're going to pay you whether that person uses the care or not. So you'd go to the doctor and you'd only show your Humana card in that circumstance. Now, it's funny because I've been doing this for, I think, 15 years now. And my husband's uncle has always insisted he wanted a Medicare supplement because he liked the idea that he could set his monthly budget and know exactly what it was going to be. He was never going to pay anything out of pocket. He didn't care if he was spending more in the long run. Whereas my grandfather has passed since this, but he was always on an Advantage plan because he liked the concept of not paying and keeping all of his money in the bank, but knowing that he had whatever that max amount of pocket was in the bank, and he could just pull from it when he needed it. So truly, it's based on your specific needs, what is important to you in a plan, etc. Before I continue, can I see a show of hands from you all? Who here is on a Medicare supplement? And who here is on a Medicare Advantage plan? All right, I figured it would probably be fairly close. So where do you enroll in Medicare? The last thing before I kind of move on is you enroll directly through Social Security. Then you decide, do you want the Advantage plan or the supplement? What do you want to do? Do you want nothing at all? Do you just want original Medicare? What does this look like? And just to kind of explain very briefly who we are are essentially a broker. We work with individuals as they need help with this. So we work with all the supplements, the Advantage plans, the Part D drug plans, and we truly just match what your needs are in a plan because we work with all the popular insurance companies. So is anyone here a client of ours by chance? I figured there might be some. So welcome, hello. Both political parties kind of got us to where we are right now in a fabulous way because if you look at this, Medicare Parts A and B were created in 1965. It was originally signed by Lyndon Johnson. Fun fact, President Truman was the very first person to enroll in Medicare, and he got the very first Medicare card. And then in 1983, this is when Nixon came in, and he went ahead and signed the kind of established controlled spending or, for hospital services, it's going to cost X regardless of where you are. In 1997, this is the creation of Medicare Part C, which now is called Medicare Advantage, but at that point was Medicare Choice. And that was part of the Balanced Budget Act under Bill Clinton. And then in 2003, you'll see here, this is when Medicare Part D was introduced. And I'm not sure why, but they chose to rebrand Medicare Choice as Medicare Advantage. I don't know, Choice wasn't exciting enough. But this was part of the Medicare Prescription Drug Improvement and Modernization Act signed by George W. Bush. And then last in 2010, the Affordable Care Act closed the Part D donut hole. Do any of you remember talking about the donut hole? It's something we used to talk about a whole lot, and it's really gone down since then. They also expanded preventative services without cost sharing, which is fabulous. I mean, it's always, you want to encourage people. The point of health insurance and healthcare is to catch things early and then move on. So that was a great move. In addition to that, these Medicare Advantage plans had been around for a while, and a lot of the insurance companies thought, I could make a lot of money off of these. So they started selling them, and they weren't necessarily all very good. So they really put some standards in 2010 and said your plans have to be at least this good. So they really regulated a lot of the Medicare then. Whether you're on a supplement or an Advantage plan today will be beneficial to you because I'm going to talk about the changes both to the Advantage plans as well as the Part D drug. And if you're on a supplement, you have a Part D drug. So they're all changing for next year. So the rise of Medicare Advantage. So in the 2020s, Medicare Advantage really started to take off. And there were a few reasons for this. The extra benefits not available with original Medicare, things like the fitness benefit, vision, hearing, et cetera, some chiropractic care, the $0 or low monthly premiums, the fact that there's no extra premium for prescription drug coverage, and the fact that you have that annual maximum out of pocket, so you know your worst case scenario going in. The simplicity and convenience of everything in one plan. And really, let's be frank, the reason these plans took off was because Joe Namath started showing up all over the TV. And, you know, it is just the aggressive marketing kind of really went out of control. You could see that it really started to take off. So in 2020, about 42% of everyone on Medicare was on an Advantage plan. 2021, it was 46. Then it went up from there to 48, 51, and 54. And they are projected, you can see here, to be about 60% of all people on Medicare will be on Medicare Advantage plans by the end of this decade. That doesn't mean they're right for everyone by any means. It's just, it kind of is what it is type thing. I'm going to talk a little bit later about, more about the supplemental benefits and why this really occurred. And I think, I actually have it at the back here, how many people are currently on Medicare. There are 67.2 million people enrolled in Medicare as of March of 2024. So obviously that's a huge number. And when you look at 50% of them on these plans, you know these plans are going to be here for a long time. So, good old Joe Namath. It's funny. My parents have a place down in Florida, and my husband's aunt and uncle are actually right around the corner from them. And most spring breaks we head down there and mooch off of them and stay with them. And we'll go back and forth between my parents' house and his aunt and uncle. And I swear to you, every time one year I walked in their house, Joe Namath was on the TV. And I just couldn't hide from him. But now it's not only Joe Namath, it's Jimmy J.J. Walker, it's William Shatner, there's another one too. They're just everywhere. And these ads truly are extremely misleading. They really lead you to believe that, if you sign up for a certain plan, they're just gonna give you piles of cash, in your mailbox, and what else they're gonna give you. You're never gonna have to pay for anything. And there's a lot of misinformation, and the marketing around these plans has just been atrocious. A few years now, I've been on maternity leave in the fall, because the annual enrollment period is October 15th through December 7th, but they could start marketing on October 1st. And you're on maternity leave. I don't know what day it is. I don't know where I am half the time. But a few days I would get in the car and drive somewhere, and it's just Medicare out after Medicare after Medicare. It must be October now. Here we go. So gear up, because this year's going to be interesting. But you could see this number on here. Just under 650,000 TV ads were displayed last year during the annual enrollment period. That means 9,500 per day. Just the sheer amount of dollars that we're spending on this is astronomical. And it's no surprise there have been a lot of complaints about these commercials because, here Jimmy J.J. Walker's talking about adding money to your Social Security check. And, most of the plans we represent, that's certainly not a situation. So it's just very misleading. So what they did is last year, CMS proposed, and this happened, I think, the beginning of December. CMS, which is the Center for Medicare, they proposed that the MAPD, which is the Medicare Advantage plans, the final rule to revise Medicare Advantage, the program, to strengthen and protect and promote healthy competition. Okay, that seems fair. Ensure that Medicare Advantage plans and Part D plans best meet the needs of enrollees. All right, that makes sense. And then the last is to promote access to behavioral health care providers, equity in coverage, and improve supplemental benefits. There's a lot thrown into that one. Most of it I'm not seeing with what's happening, but let's kind of talk about what this looks like. So, for example, the very first thing that they're going to be doing with this final rule is they're going to crack down on agents and brokers, so people like us who sell Medicare policies. And so, so far everything that I've said leads anyone to believe Medicare is confusing. It's overwhelming. They've complicated it far too much. When I pick our health insurance at the company, we have one plan. You pick whether you want the health insurance or whether you don't want the health insurance. And then when you're on Medicare, you have 300 plus options that you could select between. It's not a system that was set up for the average consumer. And so our clients tell us how confusing it is. Many people rely on agents or brokers like us to help them navigate all of these choices. And a lot of the reason they're doing this is between ads like this and some salespeople may get things like I read this all the time and I just think, where's my exotic vacation? Some salespeople may get incentives like exotic vacations or hefty bonuses to enroll people in Medicare. I haven't gotten any exotic vacations, but maybe I should have signed up for that before they changed this. Excessive compensation and other bonuses can result in individuals being steered towards particular plans. And that's not what we want. The point of having all these plans and making it so complicated is to ensure that each person can be on the right plan for their specific needs. If you're a couple, maybe you have different doctors or take different drugs, so you might be on different plans. But it should be truly individualized. It shouldn't be people steering someone into the wrong plan. So the goal here with this change is to enroll individuals in the Medicare Advantage plan or Part D plan that best meet their healthcare needs. So what they're going to do is they're changing the way we get paid and a lot of the things that they're doing here. And while I'm not concerned about this for our company, because our philosophy has always kind of been to just do the right thing and you're going to be okay. I mean, there's a lot of referrals we get as well. And if you do the wrong thing, that's, a lot of people would find out. But, at the end of the day, what they're trying to do is make it more of an apples to apples type comparison so that you're not steered one way or the other, depending on where you go. You're not going to see ads quite like this anymore, or at least we're not supposed to. We'll see what really happens when October hits. So that's the first one, is they're changing kind of some of the compensation associated with this. The second thing that they're really doing with this final rule change is and this is fabulous for all of you, they're limiting the distribution of personal beneficiary data by third-party marketing organizations. That's a mouthful, but have you ever gotten cold calls or someone calling you on the phone about Medicare when you shouldn't have? I see some nodding back there. I know my mom will always say, she'll get all these calls and finally she'll answer one because she gets mad and she'll say, my daughter works in this industry and you're not supposed to be calling me, and just hang up on them. You know what, Mom, if that makes you feel better, you go right ahead. And likewise, one of the women, and this is probably the crux of it, is one of the women that works for us and has for years, she's on Medicare, she's a client as well as an employee. Her aunt lives with her and she has Alzheimer's pretty bad. And they continue to call her over and over again. And she gets confused and she talks to these people. And, she's had situations where she's enrolled in a plan and then mentioned it to Kim when she came home from work that day. And Kim had to unwind it for the next week to make sure that things got fixed. So there's this is a common complaint and it's not something that should be occurring. So what people have been doing is if you submit your information to something, they've been selling that information to people across the board. They've been selling it to several people and they're really cracking down so that if you do submit your information, only one person and the person that you submit it to is going to receive it. It makes me think of, after I bought my first house, I was looking online and they were showing what the new mortgage rates were, and I was submitting my information there. I thought it would just show me what the mortgage rates would be. And, I think it was Rocket Mortgage or something. I got 30 calls in the first hour and it just didn't stop. And so that was when I submitted it. And I know you don't even necessarily submit your information to start getting these marketing calls. So that is going to improve this AEP. And if it doesn't, we have a real problem because they're doing a lot to make sure it improves. So what they're going to do is these third-party marketing organizations must obtain written consent through a transparent and prominently placed disclosure from the individual to share the information to be contacted. It's a long way of saying the FTC and the FCC are really getting involved in this, and that should make life easier this fall and hopefully moving forward. So the last one on here is the one I really want to talk about because I think it's going to be a perk for all of you, is the mid-year enrollee notification of unused supplemental benefits. So let's go back to when I was talking about Medicare Advantage plans, and I said they had things like hearing and dental and vision and fitness benefits. Well, in around I think it was probably late 20-teens, maybe like 2018 or 2019, they started rolling out additional benefits with their plans. Things like transportation to help take you to your doctor's appointments. Other things like an over-the-counter benefit, you could go buy sunscreen and Band-Aids and ibuprofen at the pharmacy. A whole bunch of stuff there. So basically dental, vision, hearing, wellness programs, et cetera. So in 2022, over 99% of Medicare Advantage plans offered at least one supplemental benefit, and the median was 23 supplemental benefits. So it's overwhelming. And I know I get excited about the supplemental benefits when I see them come through, and I think these are great, but then you have to remember to use them. You have to remember how to use them. You have to set them up. There's a whole lot going on with it. So most frequently offered were vision, hearing, dental, and fitness, like I've mentioned. And what they were supposed to do is address the unmet social determinants of health, such as food insecurity, adequate access to transportation, et cetera. So interestingly enough, have any of you ever been on a plan that included a food card where you go to Kroger or one of those stores? Yes, my parents were on one last year, and I swear Thanksgiving was picked up by Anthem. It was very interesting. But in 2020, only about 100 plans throughout the entire country had food or produce benefits. And today, in 2024, over 1,500 have them. So things have just spiraled out of control with these supplemental benefits. And half the time, people don't know how to use them, where to use them, et cetera. So the enrollee utilization is actually down on these benefits. So what they're doing is to ensure that the amount of federal dollars going towards these benefits, let's make sure that people are utilizing them. So what they're doing is next year, you'll receive, if you're on one of these Medicare Advantage plans, you'll get a note halfway through the year from your insurance company, and it'll tell you how much of your supplemental benefits you've used and how much you haven't used. So then at that point, it's a nice reminder and a nice jog in your memory that, hey, I haven't used these benefits, let's go ahead and do it. And just to kind of show you how, I always talk about when I go to Florida because it's such a good case study of our business, my parents and their friends and my aunts and our family. And they were telling us, I was down there for Easter this year. We were having Easter and my aunt was there talking to another family friend of ours. And she was saying, oh, I just got new pickleball paddles from my Medicare plan and I'm gonna go do this and I'm gonna go do that. And the one guy was like, oh, the Medicare plan picked up my greens fees last week. And the last one, he was saying, well, what do you mean? I'm on the same plan as you. I didn't even know I had these things. And so, it's really just making sure that you're aware of it and that you access it. If the plan's going to be crazy enough to give you $600 towards golf greens fees and pickleball paddles and gym shoes, you might as well use it. Because I don't know how long that actually is going to be around. But it's been interesting to see a lot of these supplemental benefits and where they're going. So you're going to receive that notification every year between June 30th and July 31st. It's going to show what the benefit is, the cost sharing instructions on how to use it, which is fabulous. And a network, basically just a whole host of information, as well as a phone number to call if you need additional help. So it's really going to benefit a lot of people. We spend a lot of time at our company making sure our clients use them. And even still, one of our family friends, I see her walking around the neighborhood all the time. And I ask her all the time, did you get your Fitbit yet? And she said, no, I just don't really need it. And finally I said, Jan, you have 7 grandchildren. If you don't want that Fitbit, get it and give it to one of them. There's nothing wrong with that. You gotta use what's available to you. So really, it's just going to be slightly overwhelming and confusing, but I think that one will be a benefit to all of you. So moving on. This isn't necessarily going to impact most of you, nor is it going to really change that much for next year, but I think it's very important to mention. So DSNP is the Dual Special Needs Plan. Essentially what this is the people that are eligible for Medicare as well as Medicaid. So, you always think Medicaid, oh, that's lower income, but really, you think about the older some of our clients get, maybe they've spent down their retirement savings and they're living just on Social Security, their house is paid off, they own their cars outright. And my aunt and uncle are a good example of this. I look at them and I think she's got her state teacher's retirement, she worked part-time, and he has his Social Security. And aside from that, they've spent down a lot of it. And so it's amazing how much help is available to people that they don't know is available to them. We have about 40,000 clients, and the amount that I think are aware that they have access to extra help is it's dismal. So I wanted to just share this with you because I say it everywhere. It's my soapbox. I want people to know that, if you don't think that you are eligible for it, that's fine, but it's always worth checking because if the government's going to offer it to you, a lot of people might as well take advantage. So what this means is that from 2010 to essentially 2021, so in that decade, basically, the amount of people that were on these Medicare, Medicaid plans, it tripled from 11% to 30% of all Medicare beneficiaries. It's a significant number. And this is the biggest thing, and this is why I always bring this up. 65% of people don't know they're eligible for this extra help. So I always want to mention to that. There's nothing wrong with getting what's available to you. They are changing this for next year. Currently, if you're eligible for these plans, you could switch every single quarter. Next year, they're going to take that down a notch, which I think will make it less confusing. But I'm not going to get too much into that because they're still figuring out a lot of those details. So Medicare Advantage, the star ratings. These are the ratings that the Medicare Advantage and the Part D drug plans, they're 1 to 5 stars. You can see it up here. They measure the quality of the health and drug services. So essentially what they're trying to do is empower Medicare consumers to make the right decision for themselves. So what they've done, and they really kicked this off in 2010 with the Affordable Care Act, they said, all right, we're gonna pay these Medicare Advantage plans less. And there's a lot of these plans out there, but you know what we're gonna do? We're gonna incentivize those that are the 3.5, 4, or 5 star. So we're gonna incentivize them to stay strong and encourage them to offer strong plans available. And when I say dollars, this is pretty significant because, for example, this year for a plan with 4-star rating, they receive about $1.2 million in bonus payment per 1,000 people on that plan. So it's around $1,200 per person on these plans. It's significant. And you're gonna see these stars a lot in the news, and you maybe have so far this year, because the methodology for calculating the star ratings was changed this year. And it resulted in a lot of the plans dropped in their star ratings. So, big ones here are Anthem and Aetna. They dropped their star ratings. So I think it was about $500 million that Anthem was going to receive less because of these issues. Aetna, I don't even remember, theirs was so significant. So insurers like United Healthcare and Humana threatened to cut benefits over this. And the government, some of these insurance companies started suing the government. And shockingly, that the insurance companies actually won. There was one out in California, they won their lawsuit, and now they're going to receive $250 million bonus as a result of this. It's significant. Elevance, which is Anthem's parent company now, they won a suit and have to recalculate their star ratings. So what it did is, for 2024, it's been chaos. They told us the star ratings, I think in October. They changed them again in March. We're still finding out who's getting them changed again. So they said they were going to recalculate all star ratings for 2024, which meant that insurers could get hundreds of millions of dollars in bonuses this year. Now, we do think this is only going to be a 1-year fix and a 1-year solution. But basically what they did, these star ratings have typically been based on more of the customer service type element. How easy is it for you to use your benefits? Is the insurance company answering when you call? There's a lot they're doing there. Well, I know one of the court cases was based on, they had conducted a survey with 200 people. And so this insurance company was losing $250 million over 200 people in the way they answered the phone. So it's absolutely, you look at a lot of the things and you think, how did we get here? But here's where we are. The good news is that the star ratings, how they calculate them will change again. By 2027, member experience and kind of their interaction with the carriers will be less important. And all of the star rating info is going to shift more to the health equity and disparity. So they're making sure that the people who need it are being taken care of appropriately and that people have good access to their care. So that one is something that you're going to continue to see information about that, and I would encourage you to look at it. That said, the other thing we're sharing is if there's a plan that's a 5-star plan, and there are a few in Ohio, you can choose any month throughout the year, even though you're not during the annual election period, you could switch onto that 5-star plan anytime throughout the year. So that's one of the perks of having that 5-star top plan. And there are, Kevin, there are 2 in Ohio? 2. So there are some here in Ohio. The other thing on the star ratings that I think is worth mentioning is that I've seen 3.5-star plans that I think I like better than some of the 4-star plans. And so it truly, what they use to rank these, it doesn't necessarily mean one is that much better than the other. I don't think I'd look at a 2 or a 1-star plan ever, but I've seen a couple plans that, I put my parents on one that was 3.5 and they loved it. And I think this year they're on a 4-star, but it just kind of goes to show what is your need and how does that plan specifically work for you. Kind of wrapping up Medicare Advantage plans here and some of the changes is the increase in payments to MA plans. So CMS has proposed a 3.7% increase in payments to these plans for this year. As I mentioned earlier, the government pays these Medicare Advantage plans each month to take care of you. And so that 3.7 is going to be their increase for this year. And all the insurance companies are are stomping their feet and just panicking over this because they don't think that's enough of an increase that they need. You know, groceries are up, everything is up, and medical utilization is really up, especially for the 65 plus population. So we've been hearing a lot of people, you know, every time they come out with information like this, you see their stocks drop. You look at United Healthcare, Anthem, Aetna, all their stocks are going down whenever this happens. What we're really thinking will curtail some of the dramatic enhancements to the benefits will be some of this stabilization if we can kind of ever get to that point. I still think these plans are going to be an excellent option for folks, but just kind of going to show, I thought these were some interesting stats. You know, utilization is up post-COVID. You know, during COVID and the years after, no one wanted to get their knee or hip replaced. They were putting it off. Now that that's occurring, I think it was Humana was the first one in January. I always read all of the earnings reports that these carriers come out with every quarter. They come out and they tell their stockholders how they're doing. And I always think it gives us a lot of insight as to what's going on in the business. And they started talking about how they're spending more and more on their medical, you know, they're paying more and more out from a medical perspective. And so the utilization is really up in the post-COVID world. I also thought this one was interesting. 30% of Medicare beneficiaries are hospitalized annually. So that one's pretty interesting. To go back to the post-COVID world, think about it during COVID. You know what happened? These insurance companies made piles of money because no one was going to the doctor. So it's kind of hard to feel bad for them now that they're spending more on catching up on what they should have been paying for a while. But you know, the one I really think is worth noting, and I have the quote up here, is CVS, which is Aetna. They came out last year with just this incredible health insurance plan. I'm sure there are some of you on it. It's very good. It's the one I mentioned. My aunt told me she got her new pickleball paddles and things like that. They gave her the $600 towards, you know, golfing and everything there. So between all of us and those of you on the recording, I was told by someone in the industry who no longer works there that they came out with this plan. They thought it was going to be good. They didn't realize it was going to be as good as it was. And I guess come the last week of October last year, they held a meeting internally and said, how do we get less people to enroll in this plan? Because I don't know if we can afford to keep this up. So when their earnings reports came out this year, they were upfront. I mean, this quote here about how CVS is prioritizing profit margins over membership growth for Medicare Advantage. They went on so far to say, could we lose up to 10% of our existing Medicare members? It's entirely possible. And that's okay because we need to get this business back on track. So that, I mean, I've never seen an insurance company come out and say something that bold about their plans. 10%, so they have about 4.2 million people in the country on their Medicare Advantage plan. So that's 420,000 people that potentially could be looking for a new plan this fall. It's pretty big. Humana's shares were down about 20%. United Healthcare went down about 16% this year. And it's just, Humana's been clear about they feel like they're trying to pull out of certain geographies and try to kind of reframe where they're going. But it's just been really interesting to see all of their stock. You know, you think about it, and there's not new, most of these insurance companies made most of their money previously on employer group health insurance. There's not a new company getting started all the time. And the Affordable Care Act is doing okay, but it's not necessarily growing like crazy. So really, most of the insurance companies, their stock prices and everything have been driven by what's going on with Medicare. And so now you could see a lot of their prices going down. Now, what I will mention for all of you is that we're lucky because we live in Ohio. And Ohio is typically known in this industry as sort of the king of Medicare. We have very rich networks on these plans. The plans are very strong. There's a lot of people on Medicare in Ohio. So if we were having this conversation in Oklahoma or Maine, it would be a far different discussion. But I can confidently tell you that the plans will still be good for next year. They're just going to be a little bit different. So I am going to switch gears now to talking about the prescription drug changes for next year. So the Inflation Reduction Act was signed into law in 2022. And you see our little donut holes up here. You know, we haven't talked about the donut hole as much the past few years. And what the Inflation Reduction Act did in 2022 is said this is all going to be gone. So essentially what it did was it started already by capping copays on insulin. For those of you that are on insulin, you know how expensive that can get. It also covered the vaccine for shingles with a zero copay. And when you get out of the donut hole in the coverage gap, your cost share is reduced to zero. Don't worry about that because moving forward, it's a completely different ballgame for 2025. And what this is going to do is for January 1st of 2025, for all of your Part D prescriptions, the maximum out of pocket which you'll spend on your drugs throughout the year will be $2,000. Now I can tell you when I started in this industry, I remember the first year meeting with someone and I ran their drug analysis of all the prescriptions they took and they were going to spend $12,000 that year in prescription costs alone. And it's incredible how expensive a lot of these prescriptions are. And to see that the maximum out of pocket will be $2,000 is really going to help a lot of people. But there's going to be a ripple effect from there. So the donut hole will be eliminated. Over time, there's going to be more manufacturer discounts. We're going to see a drug price negotiation program. Starting in 2026, there will be maximum fair prices. They're instituting a whole lot. But what they're doing, what this 2,000 means for 25, this is a lot of our interpretation. I was talking to a few folks earlier and I mentioned I attended a Medicare conference out in Vegas this year. And I think half the people went just to try to understand what the insurance companies were going to do about this. But it's good for consumers, but the downside is that the insurance companies are businesses. They don't want to all of a sudden go from you spending $5,000 or $6,000 a year to them picking up the remainder of the $3,000 to $4,000. So what we really foresee is that we're going to see premiums. If you're on a prescription drug plan with a Medicare supplement or a standalone prescription drug plan, we think we're going to see premiums for these plans almost triple. And it's going to be significant. That said, I've seen a couple already for next year. They're not all this catastrophic, but the problem is I think we're going to see some of the current plans go away and no longer be offered. And they're just going to automatically put you on different plans. And I think it's going to be the most important year if you're on one of these Part D drug plans. That remember every fall, the insurance companies send you a book this thick and it's your annual notification of change. I think it's absolutely critical this year that you read through that to see what's going on with your plan. Are they increasing the premium? Are they still covering your prescriptions? We think we're going to see formularies shrink, so the drugs they cover shrink. We're going to see a lot of those details. We're still waiting to kind of see what's going to happen, but everyone I talk to in the industry, this is the general consensus, is that premiums are going up, formularies are going to shrink, and it's just going to be really interesting to see what happens. So please, if you take nothing away from today, read that annual notification of change and make sure you're aware of how your plan is changing for next year. Because if not, you're going to all of a sudden go to pay your premium in January, and maybe your plan was $23 and now it's $92. That's a huge difference. Additionally, they're adding in another thing that I think will be a benefit to individuals with expensive drugs is one of the things that they're going to do, they call it smoothing. And so what they're going to do is, let's say you do take a lot of drugs and maybe you would have hit your $2,000 max out of pocket by April every year. So what they're going to say is, instead of you having to pay all that money the first half of the year or something, they're going to spread that money out through all 12 months. They're going to help you budget your plan, and maybe instead you'll pay $300 a month and then $400 or something along those lines. We haven't seen all the details of this yet, but when you go to the pharmacy to get your drugs, they're almost going to automatically do it for you. So there's still a lot of information coming out about this, but essentially they're going to smooth those costs out throughout the year and kind of spread it out so it's more regular or more even. The other thing I do want to mention is employer plans. If you're on an employer health insurance plan, a lot of those plans are they look at how Medicare prices their drugs. So this is going to really impact people that are still working and what their drug costs look like as well. There's just a lot of chaos around this right now that we just don't know the answers to. But like I said, just check your annual notification of change when it comes out in September. Now, the other thing I do want to mention is the supplements. For those of you that are on the Medicare supplements, those plans themselves do not change every year. You enroll in one and that plan stays the same. The premium might go up a little bit like your homeowners or your auto or something like that. But what we're seeing right now is those premiums are increasing more quickly than what we've seen in the past. So some of those might increase by about 10% next year. Some we've seen all the way up to 15%. But in addition to that, if you're used to that plan maybe going up 5 to 6% a year, and now it's 10 to 15, and then you add a 30% for your Part D drugs on top of it, we've seen some figures that some of the premiums that people are used to paying monthly might go up by as much as 40% a month. So it's going to be significant. Do not panic until you see it all. There's always alternatives and options. So if it really is bothering your budget, there are options available to you. But I just want you to be aware. I also want you to be aware that it's going to be a very busy fall. And that also kind of transitions me into talking about the political element of it. And I will tell you too that for our clients, any of you that are our clients, we do this automatically. We'll be running the analysis for all of you and helping you through that. If you're not our client currently and you want to talk to us this fall, Kevin's here. He's got forms on your table. I'll stick around after, but just make sure that you're aware of how your stuff is going to change for next year. So moving into the political impact on Medicare. It's interesting. I was thinking about it earlier today. This is going to be my 15th AEP, the 15th fall doing this. And what we've said year over year over year is, you don't typically see a lot of changes on a big election year. Last year, the election impacted us a lot, and it was, we only had the 2 issues on the ballot. And to really see this much change to a plan when, it's the same time period as the election, they typically don't want angry people going to the polls. But this year, apparently, they just didn't care that much. I will say, too, the other interesting thing is I thought a lot of these changes needed to occur and that they would occur maybe over the next 2 to 3 years. And to see them all crammed into 1 year, especially on an election year, it's just, I've never seen anything like it. It's going to be wild. But, as I kind of say that, my notes say, don't want angry Medicare beneficiaries going to the polls. So apparently they don't care about this year. You're going to start hearing a lot more. The Republican convention is next week. The Democrat is in August. You're going to start hearing a lot more about Medicare. We're going to talk about that a lot over the next few months with all of these changes. The Kaiser Family Foundation polls show that voters identified inflation as the most important topic for election discussion, with Medicare not far behind it. And affordability of health care, here we go, was a close second, with 8 in 10 voters saying that that's very important. So what does this mean? So what do the Republicans think about Medicare? So both of them, whether you're a Republican or a Democrat, both of them emphasize preserving the program while looking at the long-term stability. So, it's pretty cut and dry. Republicans want to cut fraud and waste, not benefits, and improve the management of entitlements such as Medicare. Some Republicans have proposed restructuring Medicare so that beneficiaries receive subsidies that they could use to pay for either federal traditional Medicare or private Medicare Advantage plans. So that's kind of the Republican take on it. The Democrat, on the other hand, like the Republicans, they want to preserve the program while looking at the long-term stability, but they've proposed expanding benefits across the board, as well as targeted increases for the most disadvantaged groups. Some Democrats are advocating for lowering the Medicare eligibility age and adding benefits such as dental, vision, and hearing, which, dental, vision, and hearing seem like just part of your health, so that kind of makes sense to me, but, that they're already included with some of them. But you'll see here when their conventions are. We'll find out more information at that point. But to kind of talk through a little bit on the funding, Medicare's, both Social Security and Medicare face looming insolvency dates, while the number of people who rely on them is projected to grow dramatically. Benefits have to be reduced unless something occurs. You could see here kind of what they're proposing and what this looks like. Medicare's Hospital Insurance Trust Fund, which covers Medicare Part A, may face insolvency in 2036, as you see on there. Upon that, what would happen is the insurance spending would be reduced by 11% as it stands now. And once the fund's reserves become depleted, we'd only be able to cover about 89% of people's hospital visits, hospice care, nursing home health care, et cetera. So everyone wants Medicare to be here and to be a strong option for a long time. What the Democrats want to do is raise the Medicare tax rate on both earned and unearned income from 3.9% to 5% for those that are earning more than $400,000, as you can see here. And the Republicans want to improve the management of the program. So Republicans have suggested lowering payments to providers and suppliers. There's just a lot out there. A couple more slides and then we'll go through questions. Apologies that I'm going long. The Social Security funding, you can see here, they're planning to run out in 2035. So without action from Congress, Social Security may only be able to pay full benefits for 10 more years. And for retirees, that could be about 17% benefit cuts as it stands now. So everyone wants to make Social Security sustainably solvent. Same with the taxes on the Democrats. The Social Security suggestions are very similar to the Medicare. I don't think anyone's come out with any great options at this point. It's interesting, I was having coffee with a woman she's the CEO of a hospice in Cincinnati. And I said, what would you do to fix healthcare? And she said, oh, I would just set a bomb and just blow the whole thing up and start over. And I thought, that's not the worst idea I've heard. But, there's just a lot going on out there. And so with that, I wanted to see what potential questions you all may have had. Medicare is a lifeline for so many adults with whether you're over 65, you're disabled, end-stage renal disease, or Alzheimer's. And I know how important it is to everyone. So it's not going away. It's just going to change. Who pays the salary for the people who make insurance recommendations? Excellent question. Our company is funded when we enroll you in a plan. Our company receives a payment from the insurance companies. Now, the way that this is structured is whether you enroll with us, call the insurance company directly, or do it online, you pay the same amount regardless. So what we do is we fund all of our clients. We use all of that money to kind of fund all of our operations. So, the person working with us, to be frank, we have a research staff, we have enrollment staff, we have lifelong support. If you have a question, you can call us. So we use that money to fund all of our operations versus most people, maybe they just sell a few hundred of these plans a year and that goes towards their income. So that's a great question. So it doesn't matter whether you enroll with a company like us or you do it online or do it with your neighbor, it's the same cost to you regardless. There is a commission fee built in. All right. Since Medicare Advantage plans are private as opposed to a government plan, how can they pay for all of the benefits they offer and still make money? Excellent question. Think about it like this. You and 5 of your friends are all on the same Medicare Advantage plan. Maybe you went to the doctor twice last year and take 2 prescriptions. Maybe your friend was in the hospital for 6 weeks last year and takes 10 prescriptions and goes to the doctor every other week. It's the balancing out or kind of the pooling of all of the money that then they spend on all of that. The government, Kevin, you know the number right now? I think it used to be that the government paid these plans between, like $900 and $1,100 per month to take care of you. So whether you're going to the doctor or not, if you're on a Medicare Advantage plan, the government's paying them that much. So that money goes a long way towards all of this. Also, their stock prices are driven by how good their plans are and how many people will enroll in them. So if that makes them feel better to give you $600 to get new gym shoes, then apparently they think that's going to help their stock. So I'm not sure if that's the best answer for that, but that's kind of really at the end of the day what it is. Advantage plans. Okay, what is the average pay to insurance per individual for the Dayton area compared to a rural area? That's a good question. I don't know the answer to that. Whoever wrote that, are you saying more payments to us or payments to the insurance companies? Insurance companies. They are definitely paid more in the Dayton area because everything costs more in a more of a city environment. That said, Dayton, Ohio is a fabulous place to be on a Medicare Advantage plan because it's a 2-hospital town for the most part. And both hospitals are in most of the networks for these plans. So yes, it might cost the insurance companies more, but to be frank, if there's all these plans out there, they can't just all of a sudden only cover Kettering and not Premier because everyone's going to switch to the ones that cover both. So I don't have the exact number as to what the insurance companies make in Dayton versus the rural areas, but there's definitely a significant difference. There's also a significant difference what they pay the insurance companies here than what they pay them in Florida. Florida's out of control right now. It's going to swing back the other direction. When you look at paying people to be on plans, that stuff's really happening in Florida. So we are in a far more stable environment. Can dentists decide which plan they will accept or reject all plans? Fabulous question. Dentists can indeed accept which plan. They are considered in network for a lot of, here's a good example. One of the plans, the dental network that they use, We get lists all the time of all the dentists that are in the network, but when our clients go and try to use their dental plan at that dentist, the dentist says, oh, I don't take that one. So I think it's a combination of the Medicare Advantage plans have to get better about the way they cover these dental plans. In addition to, I have a friend that's a dentist in Cincinnati, and he told me flat out, he doesn't make enough money on what the Medicare Advantage plans pay him. So what he does instead is he just tells all of his clients, hey, I'll give you a 35% discount on what I charge if you come and just pay me direct. And so he said it is more, but it's not that much more that it really negatively impacts them. I think we're gonna see more and more dentists doing that. I receive a medical plan through STRS, the State Teachers Retirement System. Is it true that I cannot use the Advantage Medicare plan and keep my STRS insurance? I know this, but Kevin's going to answer it for me.
So yeah, for people who are on STRS, SERS, it's either or. You could do a private sector plan, or you can stay on the state teachers or school employees plan. We encourage people to do side-by-side comparisons because of those extra benefits that are offered through private sector plans that you don't get through STRS or SERS, for example. Plus, those private sector plans are typically $0 premiums, and you're paying something for the STRS plan. So, again, it's just worthwhile to sit down and do that side-by-side comparison to see what makes the most sense.
It also depends on how many years you were a teacher for. You know, if you're 35 years plus, it's a lot different than if you were 20 years. So that we really look at all those factors when we look at that. This is a really good question. After CMS submits premium proposals for the next year, who approves this proposal? Is there negotiation with the government committee? So the 3.7% that I mentioned earlier, that is the proposed amount. We haven't come out with the final amount. There are all kinds of committees in Washington that are going through this right now. On top of that, the way that these Medicare plans work is that they start finding out, I think the government tells them approximately what they're gonna pay for them every year in February, March. And then they have a few months and they do nothing but behind closed doors, they figure out what they want their plan to look like for the next year, how they want to price it, what they want their copays to be, what their drug copays are going to look like, et cetera. And they submit those to the government in June. Then June through the summer is when they go back and forth and they negotiate. And the government will go back to the insurance company and say, I don't like this. This doesn't seem like it makes sense. A few years ago, they tried to put exterminating services as one of the supplemental benefits. And the government told them, no, that didn't work. So they have the summer to kind of negotiate. We start seeing the plans normally we start seeing them, to be frank, in July. But this year, they're really pushing everything back with all these changes. So we'll start seeing the plans in late August, and then they'll be available for you to see on October 1st. So there's a lot of negotiation going back and forth. All right. How does Medicare Advantage come up with extra benefit dollars? We kind of talked about that earlier. And how will Advantage programs, privatized programs, affect the federal program? Benefits be changed. Will benefits be changed midstream? No, benefits will, essentially what you need to keep in mind when it comes to the extra benefits is I think there's still going to be a decent, I think they're still gonna be good for next year. Do I think there's gonna be like the 600, I keep talking about that one because it's the easiest example. Do I think they're going to be as rich as $600 to use however you want in a health way? No. Do I think that you're gonna have over-the-counter benefits, transportation for those who need it, fitness benefits, vision, hearing, dental? Yes, I absolutely think that'll still be here. Why wouldn't your company always recommend the 5-star program? Excellent, 5-star plan. So the top rated plans. You know, to be frank, the plan that's top 5-star, it's a newer plan in this area. It's good. I think it's fine. I sometimes like the stability of someone that's been around longer and had plans that are, you know, I know a lot of people on and I know how they've handled the customer service and I know some elements there. Our organization, we're set up a little different in that we offer our own customer service. If you have an issue, you can call us instead of the insurance company. So while I don't look at low star rated plans, but the star ratings don't necessarily apply to our clients quite as much, knowing that we're going to encourage them to come to us instead of directly to the insurance company anyway. And knowing that a lot of the star ratings are based on customer service, it's kind of a moot point for a lot of them. So I don't know if that necessarily, that's my opinion on it. And then the other one on here is, isn't it true that not everyone could qualify for an Advantage plan? If you are eligible for, I think the only thing that'll kick you out is end-stage renal disease, and they got away with that. So now anyone, if you're eligible for Medicare, you can enroll in a Medicare Advantage plan. And if you have huge claims one year, they can't deny you the next. You could switch between them with no issue. Do Advantage plans include silver sneakers benefits? Yes. Most all of them do. Some of them might have a different fitness benefit, but I think all of them cover some type of fitness benefit. And for those of you who aren't aware of what that is, you could go to the Y's, you could go to different gyms and use your benefit there. And here, thank you. Good point. I saw the pull through there. Can you change from Medicare B to Advantage and then change back if you don't like it? I think what they meant is the Medicare supplement to the Advantage and then change back if you don't like it. The answer to that is yes with an asterisk. So when you're on a Medicare supplement, you have one opportunity to switch to a Medicare Advantage plan. Try it on for size, see if you like it. If you don't like it, any month during that year, you can go back to a Medicare supplement, no medical questions asked. Now, what I would encourage you to do is make sure you haven't tried a Medicare. It's your first time trying an Advantage plan, you have access to that. They call it your trial right. So what we do is we have a lot of clients who come to us and they say, I want a Medicare supplement because I've been putting off a knee or a hip replacement while I'm working, and I know I'm gonna have big expenses. Other than that, I'm pretty healthy. So we like to track that in our system, and then we check in with them 3 to 5 years later and say, hey, do you like your supplement or do you wanna look at something lower cost? And from there, we will show them that option. But we always keep in mind, you have those 12 months, and if after those 12 months you wanna stay on the Medicare Advantage plan to then go to the supplement, you do have to answer some medical underwriting questions. This is an excellent question. I think I've said that for all of them, so pardon me. What if you do not use many drugs? Can you drop Medicare Part D without repercussions? You could, but then if you ever wanted to get it again, you're gonna pay a monthly penalty for every month you didn't have it. That said, yes, exactly. That said, there are Part D drug plans, and I've even seen some for next year that are still very low premium, that if you don't take drugs, you can get as a stopgap. So I thought for next year they'd all be gone, but I have seen, I think you're still gonna be good if you don't take a lot of prescriptions. It's better to have that so you don't have to pay the penalty, which the penalty is 1% of the national average in premium. So if the premium's if the average is $40, it's 1% of $40. But then they add that to your premium for each month. They add it to your premium for the rest of your life. So there is gonna be a penalty if you do want it again. And it seems like I favor the Medicare Advantage. Is this a fair statement? No, I think I favor your specific thing for your circumstance. So I talk a lot about my family members. My husband's aunt and uncle that are down in Florida, he wanted to switch to an Advantage plan last year. He's got a lot of health issues. They've only moved full-time to Florida a few years, so I don't feel like they know the doctors they want to see yet. I kept her on an Advantage plan, and she loves it, and I love it for her. But for him, I told him I just wasn't comfortable with the idea of everything that he's going through for him to switch to a supplement. So I think it truly depends on who you are and what's going on in your situation. Do you plan on spending your winter somewhere else and want to go to the doctor down there? That's something to keep in mind. Do you go to do you have some kind of infusion you do that's expensive? Those are all things that we really recommend you keep in mind while going through this process.
Hi, I'm Rob Streck, your Montgomery County Sheriff. Mental health calls for service are on the rise in our community, and dispatchers and sworn officers continue to be the first responders to individuals experiencing a mental health crisis. Through crisis intervention training and mental health first aid, My dispatchers and deputies are being taught how to safely de-escalate individuals in crisis and work collaboratively with community partners to direct those individuals to services that are needed.